Hello and welcome to our Friday webinar. We are on with another excellent episode of Ask the Vet with Dr. Tom Tully. Welcome, Dr. Tully.
Well, hello, Laura, and greetings from rainy South Louisiana.
Rainy? Is it hot
Yes,
and rainy, or is it like a relief kind of rain?
no, it's like we're in this rainy pattern. So we have rain this summer. Last summer it was like triple digits, 100 degrees, which was so
Ooh.
unusual. And this summer we it's a little bit cooler, so that's good. And looking forward to another excellent session, webinar of Ask the Vet, and who knows what questions I may uh, today and try to discuss. So
That's
look
right. Yeah.
forward to it.
Well, I'm sunny Orange County, California. It's actually
There
a
you
really nice
go.
day. I had a question. So you mentioned the rain. So we always talk about bringing our birds outside, to get some UV light. What about when it's like raining? Do they like going outside when it's a
Well,
torrential or a
I'm sure that a number of our attendees have had birds outside, in the outdoor flights, and for the most part, the birds really enjoy it. It's one of those things where if you bring the bird outside, in the cage, that's a problem getting all the everything in the pan wet and all of that. So it's just it's a good opportunity if it's not lightning, or and then it's not sometimes I think it rains so hard here that it could drown the birds, if they're
wow.
outside. It's so
Yeah.
um such a downpour. But no, for the most part, if just having an outdoor, if they have an outdoor cage, that would be fine, on that. But bringing the one from inside out and getting it all wet, not purposefully, but getting it with the rain, not knowing how much, that's probably. But birds, of course, do well in the rain, and most of them enjoy it for as
Okay.
much as they want to. It's just like
Yeah.
swimming. You may enjoy swimming, but well, enough's enough. It's time to get out.
All right. Yeah, yeah, that's a good point. Let's see. So if you have a question, let's see. Just a reminder to use the Q&A feature, not the chat button. Are you ready for your first one? Let's
Yeah,
see.
I am ready. The one thing that I want to show, I did see this. I was recently at the Association of Avian Veterinarians conference, and we had been talking about omega-3, right, fatty acids, right? That was somewhat of a topic, and so this by no means is an endorsement, but just showing that there are products out there that you can purchase. And of course, I'm going to show this, and it's no, that's not going to work, is it? No,
No,
nothing
it
to
works. I
show
saw
there.
it. I saw it.
Huh? I
I
know,
saw it.
it's backwards, right?
No, no, it's not. Believe it or not, I could, unless I read backwards, it says Vet Omega.
Right. Well, it's a vet omega, and so they were promoting this at the conference at one of the booths, and and then of course on the picture you can see the chicken, the lizard, and the rabbit. So it's a one size fits all. The only one missing is the human, and probably, I don't know why they could have put the human on there too. Here I am. And so it's what they talk about dosing it, and they have the bottle, and does it work? I'm not sure. There's no validation, but it is flaxseed oil, sunflower oil, and so it's mostly the flaxseed oil was found to be better than for the omega-3 than the fish. But in the study, I think that Dr. Hawkins did out of UC Davis. But anyway, they're products, and they have a dosing on this with this product. But so you may be seeing more of this in the future. But there you go. talking about where, you know, so.
Nice.
Yeah, we're ahead of the curve here, Laura, on Ask the Vet. Our attendees are, you know, ahead of the
Oh, yeah.
curve.
We've had a lot of good questions about omega fatty acids, and we've covered a lot of territory on that. So we
Yeah, so
like,
there's a product that people can, you know, I'm not endorsing it by any stretch. I'm just kind of informing that it's out there and how well it works. You know, you'd have to find out just what your thoughts are if you use it. But yeah.
all right. We got a question from Leslie about a 30-year-old Amazon. Okay, so you ready? It's let me see if I can say all these words right. Bioacids have always tested below 50 where they should be, but on the latest test, it was 64. AST and LDH, is that the word? Were also elevated. Blood chemistry and other results were really good. Cholesterol and triglycerides actually lower than usual. The Amazon also lost about 40 grams of weight over the last 3 months, although ended a molt during that time and gained back 12 grams this week. The normal range is mid 500 grams. So the Amazon will be put on an oral dose of milk thistle lactulose and SAMe or SAMe, SAME mixture, retested in 3 months. So do you have any thoughts, comments, or recommendations about this treatment plan?
So what are the bile acid levels now?
Below 50.
Below 50. They're below 50 now.
Yeah, where they is that where they should be? Because so the latest test they were 64. So
Yeah,
oh,
yeah,
I'm sorry. The bioacids have always tested below 50, but on the latest they're at 64. So.
yeah, 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 yeah. That you know, as far as the you know, I'd have to see the numbers on the liver enzyme levels. And it says it's a 30-year-old about 30-year-old Amazon.
Yes.
Uh-huh. So this is kind of the situation that you get into with older patients. It could be younger, but for the most part, old. And then I keep getting reminded by the students that age is not a disease, but I can definitely assure you, you ask any physician out there and veterinarian, for the most part, um, do you see a lot of middle-aged people in your practice and young adults, or do you see a lot of old people or old patients? Yeah, age is not a disease, but it does lend itself to being susceptible to disease conditions, whether it's cardiovascular disease, cancer, what have you. And so looking at this is a 30-year-old Amazon. It's an older Amazon. And the main complaint, you know, it kind of started off with this is kind of pointed toward the liver, but I'm not really sure what is going on with the bird to be of a concern, because the bile acids at 64, let's just say that's a measurement of the bile acids, that could be not a significant a problem. They're just they're elevated, but that's not necessarily a significant problem. Then you have some of your other enzymes, and that's not you know, I'd have to know how much that is. But I mean, we just had a bird with bile acids that was over 500. And so that you can see, and that was actually related to liver tumor. So that's, you know, 64, and what you have it on, the silymarin, the milk thistle, you can be specific. That is a protectant that protects the the liver cells. It doesn't necessarily treat anything. It helps protect the liver cells against any damage. And then the lactulose is a product that a treatment that if the liver is not actively detoxifying because it is really has a disease process going on and it's not functioning properly and kind of detoxifying the blood, the lactulose is, that's what it's there for, to help with that. So most of the liver treatments, there's not any specific liver treatment that I'm aware of to treat something within the liver itself, as if there's a liver issue. You have the protectants, the milk thistle, the SAMe, and then you have the generalized the lactulose to help prevent, because the liver isn't detoxifying as if you're concerned with that. So looking at this, this is a kind of a general case. We have had some very difficult cases here at LSU on challenging cases. And so the one thing is what's the problem, that you're concerned with the bird, and then what you have to do is you go through the testing and to see if you can pinpoint it. And if you can't pinpoint it, then you have to go to further diagnostic tests. I always like to just run one diagnostic test. There it is, diagnosis, here's the treatment, boom, it's over. But you get these complicated cases, you have to go step by step, and you finally get to the point where you have a diagnosis. You may need CT scan. You may need to do a biopsy. You may need to do the endoscopy. You may need to go in there and actually look at the organs to see. And then you have to make sure that the patient can withstand an anesthetic event. We did a CT the other day on a little Amazon parrot, older Amazon parrot. We didn't even anesthetize it. And then we had an IV catheter in it, and we put it in a box, and a clear box, and we padded around the box, and we just put the little Amazon went through the CT unit, and we got a CT images doing that. So what you're saying, just from what I'm hearing, from what Laura has mentioned, it doesn't really scream. It says, hey, look, there may be something here with the liver, and none of the treatments, it appears that everything, as far as your the care and oversight's doing well, and the protectants is helping protect it, but it may need to go into further testing. And that's the only way you're going to find out. It's nothing magic about it. You can't just like, oh, well, that's it. You have to get something definitive and objective to get a diagnosis. So great question, but that is the problems that we face as veterinarians when you have these difficult cases. We want them to be easy. We want them to be, boom, yep, there it is. But unfortunately, we're dealing with living organisms that each are different, and there can be different things going on. So thank you for the question, because it helps to kind of explain when you get frustrated when something can't be diagnosed right away or treated, or it's not responding to treatment. We have that same frustration. Just say it.
Ms. Right. Okay. All right. We have a question from Adam that this is an interesting one. I don't know if we've had this one before. Okay. So many have suggested the ways to manage hormones in birds because you can't spay or neuter them, right? So they want to know, has masturbation been studied in avian medicine as a method for this? What are the potential negative consequences? So this year, after 2 seasons of plucking, there have been none, and they're trying to identify what change in his environment caused it. They noticed him sitting on various objects in and around the cage more often, and could this be related? So, do you see a
Yeah,
correlation?
well, masturbation is a common behavior in birds. Okay, and you'll notice it a lot of times. Owners will have no clue what it is, what's going on. My bird's behaving this way. It's rubbing a perch, and then it starts kind of having a seizure, and then it's okay. Okay. And then I mean, and so it's understandable. They just don't understand it. And so explain it to them. Now, I have not seen, the question is how it relates to hormonal or what have you behavior. I do not, I haven't really heard, or over the years, anybody saying, well, because the bird is masturbating or not masturbating, that it has an effect on the bird's behavior, general overall behavior. It's feather destructive behavior, or anything of that nature. Also, it doesn't necessarily mean that, oh, well, let's get this bird a mate and have some eggs, and fertile eggs. And, it does not correlate to that at all either. So it is a behavior that I don't think has any effect based on my observation on the birds, affect their hormonal level any more or any less than it already is, or their behavior characteristics. And it can occur, and the birds can masturbate on the owner too. So, I mean, that's something that and that usually occurs on the hand, what have you, when the owner doesn't realize what it is, and so it's just something to you'd want to try to discourage. And on the owner, the one thing that we have seen, and he brings up a good point, and I want to make sure that I get this in. We're not talking about necessarily masturbation affecting hormonal, and this is maybe where this kind of correlates. Is a stroking behavior on cockatoos, and in the closeness of that, and the kind of the, I call it a relationship, where the owner is, just thinking of petting the cockatoo, but the cockatoo's thinking more. And then this can get into where you have possible cloacal prolapse, or that is more of what we're looking at, that there may be just a behavior influence on that particular condition. There's been more of observational. There's nothing been really, scientifically proven, but kind of observational, that seems to help stimulate and make birds more susceptible, in particular cockatoos, to cloacal prolapse. So, think it's okay, but the bird's thinking a little bit more. So, good question, because it's something that occurs, and but as far as that masturbation itself, I don't see any adverse effects as it relates to feather destructive behavior or hormonal levels than they already are.
Okay. All
Yeah.
right.
Good.
Yeah. So we have a question from Liz about cockatiel. 22-year-old male cockatiel, recently diagnosed with a xanthoma on the wing. The xanthoma is small but appears to be growing. The vet said, unfortunately, he is probably not a surgical candidate. So is there anything else that can be done to help slow the progression? The vet mentioned a low-fat diet. Cockatiel is 78 grams, so they don't lose too much weight on a restricted diet. Any suggestions? Will it grow, and can you slow it down?
Well, the xanthoma is a type of in many cases somewhat of a tumor under the skin, just a little bit more. I would say it has a little bit more substance to it and complexity than a lipoma, which is a fatty tumor. And for the most part, they're benign tumors, but of course, benign tumors can grow, right?
Mhm.
And it can budgies. Birds can have these xanthomas, and they can have be a kind of a yellowish coloration, which is a little bit whereas lipomas aren't. You can watch it. You can I'm not a big fan of watching tumors grow. It's like let's get it out of there. But you have a cockatiel here that's you said 20?
22. Yeah.
22. Yeah. So um, that's the owner's done well. Congratulations. 22 years is good. Xanthomas, for the most part, as I said, mentioned, are benign and not something that is life threatening. Sometimes they're. Where did he say it was located?
On the wing. Yeah.
On the wing. Yeah, and some extremities. The and it's not only a 22-year-old cockatiel, but it's also a 79-gram cockatiel, and so that's on the smaller side for cockatiels, and so it would be a challenge, and as a surgical candidate on that, and then that's well thought out, and you're very informed. The with the xanthomas and lipomas, what I've found, and you'll read about it, you'll hear about it, it's on, it's in the books, it's all this, that if you put them on a low-fat diet, or you reduce seed intake, put them on pellets, and that these tumors will reduce in size. The tumors, in my experience, are not going to reduce in size. The tumors grow. It may not increase in size, but they're not going to shrivel up because you're on a low-fat diet. That's just like, it's a kind of akin to, well, I need to lose some weight and get some of this fat off of me. I'm going to, just stop eating, and then shrivel up. That will occur, but you have to do a lot to make that happen, other than just starving yourself. And we're not going to starve the birds. And tumors are more complex cells than just adipose tissue or fat, and in xanthomas more than that. So don't expect and don't feel bad about saying, well, I just, you have a 22-year-old bird. You need to feed it. You need to keep it in good condition. And so don't feel bad about feeding it, because the tumors aren't going to shrink. The lipomas aren't going to shrink. The xanthomas aren't. And so, as I said, it may reduce the chance of these occurring, but or increasing in size, but I think it's negligible. Okay. And so you just have certain birds that are susceptible to lipomas and xanthomas, and Amazon parrots, rose-breasted cockatoos, lipomas, and like I said, budgies, cockatiels have xanthomas. So you just have some kind of species predilection or susceptibility to the development of these tumors that you just, it happens. And especially it's an older bird. Age isn't a disease, but these can occur more often in older birds. Squamous cell carcinoma in cockatiels too. So anyway, there you go, Laura.
Okay. All right.
Thank you. Great question. Thanks.
Yeah. No.
Great group today. Yeah. Thank you.
Okay. So this is interesting. They're all interesting. So humidity.
Yeah. I mean, oh yeah.
If there's humidity, it's more difficult for animals who sweat. So like humans, horses, for example, to deal with the heat. How does it affect birds who are in conditions that are humid as well as hot? So kind of channel, I guess, like your Louisiana summer here.
Mhm.
How does the humidity?
Oh yeah. We have Louisiana sunshine hitting my window right now. That's a great question. And humidity, there's a particular reason why South Louisiana isn't a big poultry producing area. Okay. And even if it wanted to be, because of the heat index, and the heat index is the temperature and the humidity, and they say it feels like temperature, right? Well, it's 92 degrees, but with this much humidity, it feels like it's 105, right? Now, we have had outdoor aviaries, zoos, everything. The birds do fine as long as they're not out in the, where they can have shade, and it's going to be a less the temperature, and they can and so it's and that's just like kind of the rainforest, where they're in a micro environment within the main environment that's cooler, and that's why they'll always try to find those places. And you're correct, birds can't dissipate heat. That's why for years it's like birds, they can't stand a draft, they can't be cold. Birds can. They can do that a lot better than they can withstand heat. They'll die in a second if they're placed in a hot car, and there's no, they'll die in a second. I mean, literally. That's how quick it is. Their body temperatures are about 104 to 108 degrees Fahrenheit. Okay, that's their and so when birds get ill, they don't have a fever. Their temperature drops. That's why they're on the bottom of the cage with their feathers fluffed, because they're trying to maintain heat, you see. So these birds are normally with the high body temperature, and they don't sweat. Boy, my bird's sweating its head off, it's all, they're not doing that. They can't. They'll pant, okay, and they'll try to pant. And of course, if you have like macaws, their blood vessels will dilate, and the facial patches will get red. But there's not much that can happen with that. And so definitely the humidity and the heat in general, it's not a problem. But I mean, it was triple digits, very unusual last summer for 2 months. It was crazy. And the birds, they can't be out in the direct sun. They have to be under shade. And they find that's where, because you think about your birds, think about the cardinals, the titmice, the jays, the mockingbirds, whatever birds you have in your area, even the seagulls. They're not they're doing fine. Birds accommodate, but they also find these microenvironments, but you have to be aware of that so that you don't place your bird out there where you have direct morning sun and you think it's okay and the bird's frying out there. And it's not going to take long. So you have to protect the birds, and especially with the humidity is, has an effect. And but at the same time, they can accommodate to that by being in a micro environment under the tree, and where they can withstand that. So yeah.
And hydration, I'm sure, like water.
What's
Hydration.
that?
Hydrated. It's National Pet Hydration Awareness Month, so
Oh, wow. Well, it's a perfect month for it, right?
yeah.
July. Well, August is pretty bad too. Well, August is kind of the middle of summer, and I guess we could say we're right in the middle of summer, right? From June 21st to what, September 21st. So there you go.
Yeah, there we go. All right. Okay, ready? This looks like a long question, but I'm gonna get through it quickly. Okay. 33, it's this 33-year-old severe macaw has always been in excellent health and on a daily pelleted diet with Lafeber nutriberries and fresh veggies, fruit. He's in a 24 by 36 stainless steel cage with rope and petty perches, no dowels, no concrete. He developed bumblefoot several months ago. So he has the pinkish red sores on his bottom of his feet and some black spots on the grooves of his top of his toes. He doesn't seem to have any trouble walking around. Blood work and fecal came back okay. He's on SMZ for 10 days and Medicam for 7. It did not help. So on the last day of his medication, he seemed to have a seizure for a few moments. He was unresponsive. They needed medication that can go in his water bottle or spray bottle. The vet also put, is it Manuka honey on his feet and said that it was a one-time only application. So they wrapped the perches in vet wrap, but he's afraid of that. So they've been putting layers of newspaper on the grate to make it softer. The vet wants to take x-rays and sedate him. Any ideas, like as vitamin E, aloe oil, or ointment? So we got a severe macaw with a sudden case of bumblefoot, even though he doesn't have any dowel perches or concrete.
Yeah. Said natural wood, branches, things like that in there.
It's got rope and petty perches. So pedicure perches. Wouldn't that be a pedicure perches? Yeah, rope and pedicure.
Yeah. So I'm going to say a pedicure perch is like a perch that is either rough or, I've even seen terracotta perches where it's like the pedicure perches are actually something to to keep the claws / nails down. That's what I'm going to believe. That's based a mani and a petty. So that's going to be the petty. And so the petty perch. And so that's what I'm going to say. Now, the one thing that we're looking at here is that the bumble is a bumblefoot. Now, there's this is I don't know if we've ever really delved into a bumblefoot on Ask the Vet, and that's kind of interesting after all these years. After all these things. But bumblefoot is just a term called, for those who may not know, infectious pododermatitis or pododermatitis. I'm going to call it pododermatitis, and that's foot inflammation. Okay, foot inflammation, and infectious, of course, is if you have a bacteria that gets into that inflamed foot, and usually it's on the bottom of the foot. Okay, the plantar surface of the foot. Okay, now what happens is that there's a few reasons that could kind of initiate this inflammation on the bottom of the foot, a puncture wound that gets infected, a cut or a laceration that gets infected. But the majority of cases, and we see this in raptors and hawks and falcons that are in rehabilitation, or that are falconry birds that are in flight. We see this in ducks. We see this in geese that are on hard surfaces. And so it's usually started when pressure, if the bottom of the bird's foot, there's nothing there but really skin and little foot pads of fat. There's not much there. And so if there's pressure, that causes the skin to die and it becomes thin. And so there's different grades of bumblefoot, and you could go for, let's just say for the sake of ease here, there's 5, and it's been proposed that there's 5 classifications of bumblefoot, like the first being just a smooth skin, and then the next one being where you have a break in that skin and a protective barrier, and 3 is where you have really an open wound, and then it gets all the way to where you have an infection in there. So with this bird, this macaw, you look and see what causes that. Well, what causes this, these bumblefoot lesions, like I said, on ducks and geese, is when they walk on hard surfaces. And I've seen lesions, I've seen growths of from bumblefoot the size of oranges on swans on the bottom of their foot that has developed like that. You can get infection that starts eating away at the bone on the foot, which is where the infection gets into this broken skin. It all starts from the simple fact that there's pressure that causes that skin to die. And it opens it up, and then there's the bacteria get inside and they start to grow. That's all. It's very simple. So the question is that, on many birds, we see lesions, older birds, parrots, rarely do we see open wounds on parrots, rarely. But we will see where it's smooth, the skin is smooth, where it may be a parrot that's a little bit overweight. And one of the problems is when you have perches, like where the bird is sitting on the same perch, the perch surface, using the same part of the foot all the time. And so you combine a bird that's a little overweight sedentary, sitting on the perch all the time in the same spot. Well, it's like almost like you're sitting in a chair too long and your booty goes to sleep, And so what happens here is that you have the bird's foot, and so it causes pressure, and so your blood supply can't get to that area, and so it starts to die and it becomes thin. And so it's over every day. And so that's how this occurs. So I'm not sure, petty perches are pretty much what I would, from the ones I've seen, Laura, they're like dowels. And so, and they're round. That's why I recommend having natural wood perches, even going out and cutting wood, because they have different diameters and the different parts of the foot as it moves along that it has different parts, not the same area of that little bitty fat pad and the skin. Different parts actually occur. actually touch that. So that kind of prevents the bumblefoot lesion. And so you need to kind of understand what bumblefoot is to try to understand, as far as trying to prevent it. It's better to prevent it than it is to treat it. And I don't know if there's an open wound. Did she say there was an open wound, or he say there was an open wound on this?
I don't think so.
If it's just smoothness, then
Well, they
what?
mentioned the seizure.
Huh?
That he mentioned that he seemed to have a seizure for a few minutes
Yeah, yeah.
on the last day of his medication. Can a medication cause the seizure?
Can
Can
yeah, I mean, I don't know. It seems like it was on an antibiotic. Um, uh,
Medicam for 7 days and SMZ for 10 days.
yeah, like a self-medication or something. I mean, I don't think that medication could, I mean, there's always a possibility in medicine. I don't say, it's possible, but it's not
Oh,
like,
pinkish red sores, I think is what.
what's that?
Sorry, just getting some more detail here.
Oh, that's okay. That's all right. Yeah.
Yeah. Pinkish red sores is what.
Pinkish red sores. Yeah. And so if it's something like that, then there you'd have to, it's if it's through the skin or not through the skin, is something that needs to be addressed, because just treating it, and again, as your bird's been, is taken care of really well. These type cases, it does help, I believe, to have supplementation. Vitamin A is one that is very integral in the epithelial or skin health. Vitamin A, I would say, is when you're looking at a multivitamin, we've talked about the multivitamins before. Since this is a Lafeber webinar, Lafeber has an excellent multivitamin for birds. Necton is another product that I really think is a good product. Vitamins for birds, but when you're looking at this, it's not like you're going to actually have the bird the antibiotic or the meloxicam. It's going to help the bird feel better, but the problem is the bird is still it's still perching, and it's still the problem that was causing it in the first place is still there. So you're going to have to try to, and then I know that you said you put vet wrap around the perches, and the bird freaked out and said, "Wow, what's that?"
Yeah.
Then it's one of those things where you need to get new perches. You need to get perches where it's varying diameters, varying, I guess, different undulations in the branch, and so that the bird can actually perch with use different areas. Now, if you have open wounds like this, then there's the possibility in what we like to do with our raptor species and our ducks and geese is actually remove or freshen that area if it's not infected, and close it with a primary incision. And we know that it'll heal in 14 days. So that's the way we kind of expedite the healing in some of this, and at the same time going over the environment to make sure that the underlying cause of that is resolved. So there you go.
Okay.
Great question. I don't
Yeah.
know. Talked about bumblefoot and infectious pododermatitis, and people talk about it all the time. And And it's something like this is something to prevent. You know, again, you want to prevent this from occurring in the first place. But sometimes if it does occur, you want to be aggressive. Now, if the bird was having a seizure, that's something else that, like I said, it's unlikely that it was the medication, but maybe that would be something that they'd want to get looked into. Yeah.
Okay. Question from Shelley about 3-year-old cockatiel that has
How
gained
much?
20. A 3-year-old cockatiel, three-year-old cockatiel, has gained 20 grams since January. So now the cockatiel is at 120 grams. So the only thing he eats now is nutriberries and pellet berries, like a total of about 10 a day. They've cut out all other foods, including the oat and groats, but he has a couple bites of millet when we have breakfast together. That's cute. He's flying, climbing all over his cage, sleeping fine, doing his vocalizing, grinding when happy. So at the vet, the weigh-in was 116. He said that his keel feels fine, the keel bone feels fine. Saw no other signs of being overweight, unable to take a blood that day. So they have another appointment coming up. Do you have any suggestions of blood work or tests to make sure he isn't sick in any way? They're just concerned about the quick weight gain. So is 20 grams a huge amount of weight for a crocodile to gain in a
Well,
120 grams okay, 116 grams okay for a cockatiel?
well, that's a great question. That's a great question.
Oh, it's a fully and it's a fully flighted bird, so it's getting exercise. You know,
Yeah. That's a great question. It all kind of what it depends on is the bird body conformation. Okay. And 20 grams in 100-gram bird, you know, you're looking at you know, a fifth of its body weight, right? You know, and so just think about yourself and gaining a fifth of your body weight, you know, within I don't know how, you know, it's a
January.
yeah, so within a 6 months period, you'd be feeling it probably if you put on a fifth of your body weight from what you were in January. You'd be going, yeah, I can tell. And so that's and so you have the little cockatiel, or a big cockatiel, I should say. And you look at the body conformation, and what we look at in birds is the keel, the pectoral muscle, the main muscles that are the flight muscles. And again, if you know, if the bird is like a Thanksgiving turkey, where you have the breast and the keel is buried in the pectoral muscle, well, it's you know, over conditioned too much. Okay. But if it's just kind of even with the keel, and it doesn't even with in African grays, the keel may be somewhat kind of out a little bit, but if it's kind of like an arch, a nice arch, then that's kind of perfect. Okay. And then of course, if it's like caved in and you just see the keel and it's razor thin, you know, and then that is too thin. So we have a varying degree of body conformation, or what we call body condition, from the Thanksgiving turkey to the caved in, but you have the perfect arch in the middle. That's just right, just like Goldilocks. And so then that's what you want. And so each bird is a little bit different. Was gaining weight in the 3-year-old, you know, it seems like 20 grams is pretty. I guess it was 20 grams, as they say, it gained over that period of time.
Yep.
So what you look at is like, why did it gain 20 grams? Is it body conformation, what have you? the physical exam, examining, is it fluid that it has? It doesn't appear as such. What we normally do on a physical exam, unless there's some obvious issue or concern or obvious disease condition or problem that you see, is do a complete blood count, looking for inflammation, looking for, it's just like when you go in for a physical exam, they're just not going to look at you and say, oh, you look good to me, see you next time. You usually have to go get, what's going on inside. So this is all consideration. 115 gram is cockatiel is on the upper end of the scale. We talked just about a 79 gram cockatiel.
Yeah.
That was and so like I did mention that was smaller. Well, on this session of Ask the Vet, we've had the alpha and the omega of cockatiel sizes, and that's great. But it's possible, but if the bird, but you have to kind of assess that to see if that is a problem. But and that's what you do, because it may not be. It's somewhat unusual, but if it, the bird fills out, but a 3-year-old cockatiel, you'd think it may, but at the same time, the cockatiel may have been under condition. And then all of a sudden, whatever was holding it back, it's blossomed, so to speak, and it's not overweight, but it's in its normal, it fits its body conformation. We have a big cockatiel, and I mean, we've had cockatiels 115, 120 grams, and we've had them 75 to 79 grams, but they're small cockatiels, and then you have the larger cockatiels. And anybody that's had cockatiels or seen or been around them know that there's that variation. First thing that comes to mind are blue and gold macaws. I've seen big ones and I've seen small ones, and so you just so that's I think we had one over a kilo the other day. It's not often that we get one that big, but yeah.
Oh, that makes. Sorry, go ahead.
No, go ahead.
I'm fascinated because I've seen like dwarfism in like cats. Like do you see dwarfism in birds?
I mean, you could, as far as a small, you don't get like mini birds, you don't get like mini cockatiels, but you know what I'm saying? You get smaller size birds. The genetics just like boom, that's what happens. And so you get the 75, 79 gram cockatiel, that's their size. Then that's their weight. And then you get the, the gigantic, birds, 115, 120 grams. And on both ends of the spectrum, so it's just like a bell-shaped curve, it's like, whoop, you get a few of these on each end, but you get most of them are the 90 to 100 grams, right? So that's most of the birds,
Oh, it's fascinating. It's interesting. We had one question about an underweight teal and one question about like a more robust teal.
Yeah. Oh, yeah. And then just FYI, from what I'm to understand, the Guinness Book of World Records, for age of a cockatiel is, I think, somebody had mentioned like 32 years old, 33 years old, from what I'm to understand. I would think it may be because the average age is usually around 15 for the cockatiel, but we have had, and we do have some that are in their upper 20s. So,
yeah.
Yeah.
Wow. And I just
out there with, older birds that are still chugging along. There you go. Something to shoot for.
Yeah, for sure, for sure. Just curious, what do you tend to see birds come in that are underweight or overweight? Or does
That's
it
a
depend
good
on the bird? Like I'm
question.
sure it might
On
depend on the bird.
average, on average, we tend to see more that are in good body condition, meaning appropriate weight, and weight, and it is body condition. You're either over conditioned or you're under conditioned, and so right where they should be, or underweight, because they're sick. Okay, so we're kind of skewed because we see birds that may have been ill for a period of time and lost weight. We do see our share of overconditioned birds, but it's not as often as you would think. Actually, we don't see as many as you would think. Most of them are in have a good body condition. Yeah.
Okay, that's interesting.
Or
Yeah.
under condition because of a disease process.
Mm.
Yeah.
So like for like the annual wellness exam, they're pretty much.
Yeah, exactly. And and of course there can be surprises because somebody can look at a bird, see, and it's one of those things like as I always say about birds, you'll hear they hide their signs, and I disagree with it. I think that birds can't hide their signs. It's just like you want to, but if you don't feel good, you just don't feel good,
Mm.
Now they may hide their signs if you grab them and you're taking them to the vet, and it's like all like, their adrenaline is like, wee, they'll hide their sign then, well, he wasn't doing it. But under a normal environment, birds won't hide their signs, but if you don't know what to look for, then they're hiding it because you can't tell if they're acting normal or not. And what happens is that the feathers covering the body, you can't tell that it's losing weight, right?
Yeah.
It looks like it's like you're wearing a big coat and you open it up and there's a skeleton there. You think that there's, and so the feathers really kind of prevent to saying, oh, well, gosh, look how thin that bird's getting. It looks, no, like it's normal. And then you feel it, it's just skin and bones.
Wow.
So it's hard to kind of assess that, but yeah, that's what the annual exam does. And then also it kind of gives you a chance to look inside the bird to see, because if you get an exam without getting at least a complete blood count, it's just it's a halfway. You don't even know what's going on inside, but
Wow.
but that's part of it, and then that kind of gives you an idea of the overall health and why it's so important. And then at the same time monitoring that body condition, and then also you are correlating that to previous times, and you can look at a trend or what have you, just like that lady or that attendee that said, well, they've monitored those bile acids. You could do that, you see. And so they know what they were over time to see if that is a problem. So what the trend is at this time it's kind of going up. I don't think that they're just in the face of that significant to kind of point to anything, but 64, but it's something to be aware of and monitor. So that's where all of that becomes helpful.
All right.
Yes.
There we go. So that's I think we wrapped it up. We'll have to address some of these questions maybe at our next Ask the Vet, which will be next month with you. We'll have you back here. And if we didn't get to a question, maybe we can send an email reply too. So we had some really good questions, and we
Oh,
it's all of them.
thank you. Oh, yeah, thank
Yeah.
you. Thank you, Brenda, Laura, for, reading and going through it. You did fantastic.
Didn't
And
kill any words as
all
much
of the
as
webinar hosts, yeah, I mean, and then Brenda, and then all of our attendees. Questions were fantastic. We had a lot of new questions, and there's always more.
yes.
So definitely look forward to next time. Yeah.
Definitely. Okay. So I got to announce, we have a winner of today's giveaway. And so I have a couple special announcements. So one, I got to announce today's giveaway winner. That is going out to Liz Randerson. Congratulations, Liz. I'm going to try to show you. So you get some of the newest there we go. Freshest ingredients, the strawberry.
All right, there you go. Strawberry Nutriberries.
And if you haven't had these yet, or if you haven't ordered these yet, they smell so delicious. Like I want to step on them. They smell like fresh strawberries. As soon as you open the bag, it's like the aroma of fresh strawberries is just yeah.
I like it. I like
I hope that makes your bird's day, as well as another product of your of Lafeber of your bird's choice. So Liz, you're gonna get the strawberry Nutriberries as well as another product of your bird's choice from Lafeber. So congratulations, and they have both sizes. So they got the small bird. Sorry, okay, this is the parrot size, and then they got the small bird size because we're not gonna forget about the little budgies and cockatiels and lovebirds and the little guys who also deserve and love fun nutrition. So there we go. Congratulations. Okay, so we'll be back August 2nd, with Jamie Whittaker from the American Federation of Aviculture. And so there's a big conference coming up in September. That's the American Federation of Aviculture. They'll be in Costa Mesa, California, which is really close to me. So I'll be there, as well as, guess what? Dr. Lamb is going to be doing a presentation there on the Saturday. So I get to meet Dr. Lamb in person. I've only met her virtually, so I'm extremely excited about that. If you're in the area, if you're in Southern California, or you want to make a trip to Southern California, I highly recommend try to make the trek over to the AFA conference. It's the first weekend in September, so the 4th to the 7th. And Lafeber is sponsoring the family day on the Friday, so good times and a lot of good information you'll be learning about the yeah, there you go. So
and Laura, I want to mention that tomorrow I'm going to be in Mobile, Alabama, at the South Alabama Caged Bird Society annual bird and animal expo, and I will be providing an on-site Ask Your Vet at that. If anybody there knows anybody in the Mobile area, it's a fantastic event and always well attended. Excellent displays, and it's fun.
very cool.
Great thing. So just to, anybody that's in the area and along the Gulf Coast, there you go.
There you go. You can see Dr. Tully in person.
Well,
I want to and ask your questions to him. There you go. All right.
We'll be on top. There you go.
Now people are going to be under the impression that you just travel around virtually and physically just answering bird questions.
Well, South Alabama Bird Club, Bird Society, the Caged Bird Society is great. And I've been with them, a member, for many years now. And so always happy to help out there.
Oh, that's awesome. Okay. Well, there you go. So if you're in that area, go see Dr. Tully. Yeah. So we got the you got the West Coast, and you got your area.
Gulf Coast.
Go meet Dr. Lamb in California. Go meet Dr. Tully. You said this weekend?
Yeah, tomorrow. Yeah, tomorrow and Sunday, both days, but I'll be there tomorrow. Yeah. Mm-hmm.
All right. Okay, guys. On that note, we got a lot going on this weekend. Everyone stay safe. All the best to you and your flock. Till next time, have a great weekend, everyone.
Thank you. Thank you, Laura. Bye. Thank you. Bye-bye.